this is a humanitarian crisis. We're dealing with a completely calamitous situation. We're getting about roughly 25,000 infections a day. The documented number of deaths is about roughly 350 to 380, but it's entirely possible that we're not recording a lot of cases. All our hospitals are full, and when our hospitals are working at augmented capacity, we're working at full capacity. There's scarcely a bed available for treatment. All our ICUs are full. There's a wait list for patients to get into hospitals. For instance, the hospital where I work, which is a large tertiary referral institute and more or less a dedicated COVID center, the wait list is upwards of 800. And so there are patients we have to refuse. There's a massive queuing up in crematoria, so sick patients are not able to get into hospitals. Dead people are not, able to get into crematoria. It's an all-round dire situation.
So when you talk about people queuing up, are people still turning up to your hospitals in the hope of getting a bed, despite the fact that there is a wait list, despite the fact that there is no space?
Absolutely. What do you do? I mean, you've got individuals who are being brought in all modes of transportation with portable oxygen cylinders and Hudson's oxygen masks on their faces. We're dipping oxygen levels in various degrees of altered sensorium with severe COVID. And they're just, lying outside of hospitals because there isn't even space for us to keep them in our casualties. So, and it's the same situation all over. Our hospitals are barely able to survive on oxygen supplies which are lasting for hours. Every day, administrations from these hospitals are having to send out SOS tweets to the central and the state administration to provide oxygen. We are having to move courts to ensure an uninterrupted supply of oxygen. There have been instances where in many very large hospitals in the city of Delhi, oxygen supply has completely run out and people have died because these were people hooked on to life support systems.
Yeah. Alarmingly, we see the government telling people to seek drugs on the black market. How dangerous is that?
No, so there's been a run on most drugs, and a lot of that is also attributable to the fact that a lot of these remedies, which aren't established remedies for COVID, are being prescribed indiscriminately. For instance, the antiviral remdesivir, which even in the WHO issued a conditional recommendation that it doesn't really confer any mortality benefit in COVID, indiscriminately is being prescribed, and therefore you're having a run on these agents, and which is why you will have a black market for any commodity that's scarcely available in the market. It's very unfortunate.
You usually work as a vascular surgeon. How have you been diverted to other areas, given that this hospital is now almost dedicated to COVID relief?
So I'm primarily looking after the vascular complications of COVID, which are, quite frequent. But all of us are on a roster. You have all specialists of all stripes and shades who are being drawn into COVID service: gynecologists, orthopedicians, plastic surgeons, gastroenterologists, nephrologists, neurologists, vascular surgeons. We're all on a kind of rotating roster of COVID service. We're having to triage, sometimes work in wards, very rarely in ICUs, but everyone is doing their bit and everybody is busy.
I'm wondering how dangerous you feel the position many of the frontline workers like yourself and the nursing staff are, given you're so close to this, that the virus is spreading almost indiscriminately.
Well, I think as long as you're taking adequate precautions as per the COVID protocols, you're reasonably safe. But the problem is one of fatigue, because a lot of my colleagues have been working tirelessly through this pandemic, and it's been a little more than a year, and it's gutting because there's absolutely no respite. This is on and on and on, and the current surge, and particularly I'd like to mention the nursing staff, because, they have to actually man these stations 24/7. The doctors outside of emergencies don't have to be physically present next to a COVID patient all the time, but nurses have to constantly be there and attend to every little call that they receive, administer medicines, responsible for change of patient positions, monitoring of vitals. Every little thing falls upon the nursing staff, and they're perhaps the most overburdened currently.
Indeed. Your wife works in obstetrics. How is the virus impacting mothers and newborns?
Well, it's entirely a factor of how much the virus is going around in the community. Right now, infections are at an eye-watering level in Delhi, and therefore, a large fraction of laboring women who turn up for, during the end of their gestation turn out to be COVID positive, and they have to have a special facility where they can be delivered. In our hospital, we're having to deliver at least 3 or 4 COVID positive women every day. Special protocols have to be in place. Then the neonates that are born have to be segregated. So it requires a whole lot of arrangements that aren't that have to be brought into place all of a sudden. And this time round, the epidemic gave us absolutely no time to react because the numbers just exponentially kept on increasing.
And are you seeing, as you make your way home after a long day at the hospital, are you seeing signs that behaviour is changing? We are still seeing images of people out and about, not wearing masks, not isolating, not self-isolating.
So in Delhi, currently there's a lockdown in place, which means all economic activity has been suspended. Offices are closed, only essential services are on, and therefore you really don't find people going out for work or for other reasons of entertainment or recreation. But there are other centers in the city, other metropolitan areas, which are not in a lockdown and where the number of cases are escalating very rapidly. So the government has brought in a set of guidelines which are saying that any metropolitan area where the test positivity rate is more than 10% will have to go into a lockdown or at least a limited lockdown to prevent transmission. Because you have, as you correctly said, we have a large population, and a lot of them are errant and delinquent in terms of masking, and it's simply not possible to have physical distancing measures in our cities because in our metropolitan areas, the per capita density of living index is very, very tight. It's about 50 individuals per square meter, which is tighter than what an American prison cell looks like. So it's going to be very difficult to have any semblance of physical distancing in these areas. So you'll have to find very innovative and creative methods to actually try and block transmission. And sometimes a circuit breaker is absolutely essential. You need to kind of shock and paralyze the system and completely suspend all economic activities, perhaps for about 2 or 3 weeks, to acutely stop transmission.
How critical do you believe international aid is now to try and help you cope with this situation?
Well, everything that is going to alleviate the situation is going to be helpful. Right now, there's a scarcity of resources in Delhi. I mean, I'd say there isn't just a scarcity, resources have run out. We don't have, there's some speculation that if multiple cities start flaring up at the same time, all the oxygen that we produce might not be able to be diverted to areas that have flared up. So because we lack distribution assets, oxygen production takes place in a certain kind of geography in India and the cities that are currently flaring up in another part of India, and you need kind of cryogenic tankers to mobilize oxygen from the area of production to where they're needed most. And therefore almost all of our industrial oxygen production is being diverted for medical use. But if more and more cities start flaring up, then we might have a real problem of distribution assets. We might have problems of oxygen cylinder production because every resource is a finite resource, and we had never factored in for this kind of an exponential rise. So we are simply going to run out of resources.
We wish you well. It is, we can't even imagine what you are going through right now, but we do appreciate your time. Thank you so much.
Thank you. Thank you very much.